The things that mattered to me were really the heart of the program. Interviewing with the faculty here at St. Louis University Cardinal Glennon, I could tell that they cared a lot for the populations they serve and that they're really engaged in taking care of us as learners. That's always been the driving force for me.
SLU was my first interview, and I fell in love with it immediately. Everyone was so including and just so welcoming.
In the pediatric program, and especially in the ICU, we are kind of spoiled because all of our attendings, or most of our attendings, are from really different backgrounds. It actually helps you develop your own way of practice and your own way of thinking about things. They actually embrace residents and fellows asking questions because that's the way they know that we're interested, that we want to learn, that we're invested in the training process.
The people who choose to work here are graceful and collegial and competent. We care about you as a person and as a partner, but we also know that you need to really be good at what you do so that our mission can endure. I want to be the kind of a program that really nurtures careers by listening to what the concerns are.
There has to be an open line of communication. The learning curve is really steep in the beginning, but the program in general, and my program director, he's made sure that all of us are well taken care of. There's a lot of hours of work, there's a lot of sleepless nights, there's a lot of calls, and that comes with what we do, but at the same time making sure that in between those we have the opportunity to just have family life. I think the program provides enough opportunities and at the same time resources to achieve that.
People have lives outside of their careers that are really important to them, being a well-rounded physician that can have empathy with their patients.
Work-life balance is clearly important to the faculty members. There's a lot of opportunities in St. Louis to be able to have fun and enjoy your free time.
I absolutely love St. Louis. They have huge parks that you can go visit, tons of restaurants, nightlife, music, theater, culture. If you take advantage of the opportunities, they are there to have that work-life balance.
People come to SLU because they're loyal to the mission, providing care for people regardless of race, creed, or ability to pay, and preserving our patients and their families' dignity.
The way that we embrace working with the underserved provides unique experiences. The holistic way that we treat patients and their families, and specifically in the PICU, we are a 22-bed ICU. We serve a wide variety of diseases. We have all the specialists in-house. We are a very well-rounded pediatric ICU. Part of it is having a really good relationship with your consultants, and in Cardinal Glennon, SLU, we have them.
We have a pretty collegial relationship with the other subspecialties because we do depend on them a lot for their care for our complex kids and even for some unusual things that walk through the door. I can't think of a time when I wasn't able to get the care that I needed for the kid in front of me.
It's a supportive environment to help you become the best physician that you can be.
They're very caring and they're really invested in us as learners doing well.
Our focus, our goal is always going to be patient care, good patient care. Making sure that they have the best care that they can is actually one of the things that I love about this place.